And we are live. Hi, ladies.
Hi.
Hello.
Welcome, everyone, to the Melanin Initiative. I am Dr. Kimberly Madison, a doctorally prepared nurse practitioner, and one of your co hosts here at the Melanin Initiative podcast. In healthcare, we believe that there's often too much information and not enough time. But here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions, and we share a nursing perspective without taking too much of your time. Today's a really special episode. It's we're going to talk about the reason we even started this episode, which is high blood pressure. We'll be talking about what it is, what it's not, and how to lower your risk. Remember, this show is for educational purposes only. The opinions expressed here are ours alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. Our TMI takeaways for today, or the things we hope you learn by the end of this, is how to describe what happens to your body when you have high blood pressure. We want you to be able to name at least 3 risk factors for high blood pressure and some complications associated with those risks. Identify the goal that the American Heart Association has set for most people, how to properly measure your blood pressure at home, and when to seek medical care. Geraldine, you want to start us off with a formal definition?
Sure. So, the American Diabetes Association defines high blood pressure as the force of blood flow inside of your blood vessels. So, typically, when you go to the doctor's office or if you're ever getting your blood pressure checked, your healthcare provider will record your blood pressure as two numbers. For example, 120 over 80, which I just want to make a point that both numbers are very, very important. The first number is what's called your systolic blood pressure, and this number is the pressure as your heart beats and pushes through the blood vessels. And then the second number, which is known as your diastolic pressure, is when the blood vessels actually relax between heartbeats. I do want to note that both numbers are important. You can have a low top number and a high bottom number and still be considered be considered as having high blood pressure. So that's what I definitely want to make sure to note. Kimberly, how would you describe high blood pressure to your patients?
Okay, so actually, everyone, we're going to be starting this, adding this new feature to the show. The show, if you watch it on YouTube, we're going to be having some graphics to accompany our conversations. And this is, it's courtesy of one of our viewers who thought it might be helpful to help get our point across, and we couldn't agree more. So here's a picture of an artery. You have two kind of blood vessels in your body. One is an artery; it brings blood back to the heart, or away from the heart, and then you have a vein, which brings blood back to the heart. So this vein or this artery looks a lot like a hose, a water hose that you have at home. You have a brand new water hose. What's on the inside of that hose? Just water. Just like this beautiful, healthy artery. The only thing on the inside that we want to see is blood. Blood transports oxygen and nutrients to our entire body. So if we start to have problems in an area of the blood vessel, then we can expect to see problems anywhere throughout the body. So you have that hose, time goes by, it starts to build gunk up inside. What happens to the water pressure that's trying to get through there? It builds up because as volume goes down, right, there's less space in there, pressure goes up. And we see the same thing happening in our blood vessel. And so when we take a look at what happens when the certain parts of the body don't get oxygen or nutrients, we start to have complications because every part of our body needs oxygen. If it doesn't get oxygen, that tissue starts to die, and sometimes it doesn't come back. So we are going to go from head to toe. In nursing, we do something called a head to toe assessment. Maybe you've noticed. I know all my patients always ask me, "What am I doing?" And I'm asking, even though you have stomach pain, it could be coming from a million different places. So I'm
Mhm.
going to ask you about, and I also want to evaluate your risk for other things too, right? So I'm going to ask you about things from your head to the sole of your feet. So let's start at the top of the head where we have the brain. So one of the things we worry about when people have high blood pressure and they're not getting enough oxygen and nutrients to their brain, if that plaque buildup on the inside builds up so much, you can develop a stroke, right? And so parts of that brain tissue start to die. And that's why people lose their vision, their ability to talk, walk, move their arm, swallow appropriately. things like that. Read, understand language. We get to our eyes, it can affect the way of vision. Maybe it starts to get blurry. Maybe we lose a whole function of that vision. Maybe we can't even see anything on the peripheral, and we start to see these spots. That's why it's very important. When we talk about primary care, we're talking about preventative care,
Mhm.
right? So if I see you have high blood pressure, now I know you're in a particular risk. I'm going to start to screen you for things to prevent that from happening. If you start saying, I'm having blurry vision, I want to stop it before it gets to blindness,
Mhm.
right? So primary care includes the eye doctor. When we go to the heart, same thing as in the brain. If that blood vessel gets so clogged up that the heart can't get oxygen or nutrients, some of that tissue starts to die. And when it starts to die, we have chest pain. And that pain starts to radiate all the way up to the neck and down the arm. It can cause nausea, can cause a stomach upset if you're a woman. Maybe you just get fatigued or sweaty. We want to stop that from happening. If we go down to the kidneys, they're not getting oxygen, they're not getting nutrients, they can't do their job. So they start to slowly die down. And that's how people end up in kidney failure, and that's how they can end up on dialysis. We see the same thing in the reproductive organs, both in people who have a vagina and people who have a penis. The whole idea of an orgasm is blood flow rushing to those organs. Blood can't rush if there's something in the way. So then you're not going to get the outcome that you desire. Same thing in your fingers and your toes. The further away those body parts are from the heart, the more they have to travel, and you're asking them to travel through all that pressure. And that's how people can end up with amputations.
Mhm.
So those are the complications. Did I leave anything out, ladies?
No.
No.
I think that it's important. A lot of people may be thinking, well, when do I go seek medical attention? Like, when should I go see a doctor? And I'm going to like kind of run through a scenario for you. So you go see your primary care provider and they take your blood pressure and, in the triage area of the clinic, and they find that your blood pressure is, let's say, 130 over 90. Not too bad, but definitely room for improvement, right? So they're going to send you home and ask you to do some lifestyle modifications. They're going to ask you to quit smoking. They're going to ask you to exercise and potentially change your diet, right? So you do that. You come back in 6 months and your blood pressure is 160 over 80. So that's getting worse. So now we need to probably introduce a medication into your regimen. You're going to continue taking your lifestyle modifications and you're going to add some medication. So you do that, you go home, and you come back in 6 more months, and now your blood pressure is 199 over 100. Your primary care provider is now going to tell you that you're going to have to go to the emergency department because a blood pressure of greater than 180 on that top number and a blood pressure of greater than 120 on that bottom number, we consider a hypertensive crisis or hypertensive urgency. Or in other words, really, really, really high blood pressure. So you could be experiencing symptoms. You could be having a headache, potentially chest pain, nausea, vomiting, dizziness, or you could be feeling nothing at all, depending on how long your blood pressure has been this high. Our bodies are very adaptive things. And if your blood pressure is high for a really long time, it gets used to that. So it could potentially, your blood pressure get really high for a really long time and you don't even realize it. If you're at home and you recognize these things, you should definitely call 911 and seek medical attention immediately. However, like I said, if your body has adapted and you don't know, your primary care provider will be sending you to the hospital. So, and then you may see one of us.
Mhm.
And from there, they're going to give you some medications to bring it down immediately. It may go through they may put an IV in, give you some medication through there, and then keep you in the hospital for a few days or so to control it back down to a rate that's a little more acceptable. Definitely going to be less than 180 and less than 120. And the expectation is that you follow up with your primary care provider to sustain those changes, right? So we always bring it back to following up with your primary care provider. As we said in previous episodes, the hospital is there to help get you out of that crisis mode so those major complications don't happen that Kimberly just talked about, stroke, things
Mhm.
like that. But after that, you have to follow up with your primary care provider to sustain those changes. And that's where your work comes in. So there's definitely ways to check your blood pressure every day. And we're going to tell you how to do that. So, first things first, you have to get a blood pressure machine. We recommend that you get an automated blood pressure machine. And Kimberly, our model up there is showing you what one looks like. The automated blood pressure machine will give you digital numbers, and it will show you um, the actual rate of your blood pressure. And you're also going to get a cuff that goes along with it. It's gonna if you're in the hospital or in your clinic, they may either use a manual where they squeeze the blood pressure cuff and they put stethoscopes in, they listen. But we do not recommend that for you because that's specialized training that we have, that we know what to listen for. So some things to know about this particular cuff is that you have to make sure that you have the right size. So it's going to be on the upper arm, as Kimberly is modeling so beautifully. There she is. But you want to make sure the cuff isn't too big, because sometimes when the cuff is too big, it can give you a false reading of too low. Now, if the cuff is too small or too tight, it's going to give you a false high reading. So you want to make sure it's comfortable, it's not too tight, not too big. In addition, prior to taking the blood pressure, you want to make sure that you're not exercising, no drinking caffeine, and no smoking 30 minutes prior to. That could give you an elevated false reading. You also want to make sure that you're sitting still. You want to make sure that you keep your hands on a flat surface like a table and at the heart level. And then you want to sit upright with your back straight and your feet flat. And of course, while you're taking the reading, you do not want to be talking. So after the reading, if you notice that anything is out of whack or doesn't really seem right, try taking it again in a minute or so. It's important that you are keeping a log every day of these, or whatever you decide to do with of what your blood pressures are. When you're going to your primary care provider, the more information you can provide them, the better. And you want to bring these with you to your meetings with your primary care provider. It's how they're going to be able to better give you advice, whether what other lifestyle modifications you can make or what additional medications, if any, they need to start you on. So I'm going to pass it over to our colleague Geraldine to tell us a little bit more about when you're in the clinic, what kind of diet modifications are you telling your patients they need to do? Because we know that diet plays a huge role in blood pressure management.
Okay, great question. So yeah, I definitely get a lot of patients that come in, that young and old, that have elevated readings, and whether they have a history of high blood pressure or they don't have a history of high blood pressure, my spiel is always the same. Because if you don't have high blood pressure, I don't want you to go on cross over into that category. So I'm always telling patients to make sure that they're following what's called the DASH diet or heart healthy diet, which includes eating lots of fruits and vegetables and whole grains, as well as sticking to low fat dairy products, eating like lean fish and lean poultry, beans, nuts, and seeds, and kind of staying away from like the fatty meats, such as like your red meats, like steak and bacon and pork and things like that, as well as like staying away from full fat dairy, sugar, sweetened beverages such as your sodas and juices that are high in sugar, sweets like your cupcakes and your ice cream, as well as sodium. Sodium is a huge factor as far as blood pressure is concerned. And a lot of times when I get patients in the clinic, a lot of when they have high readings, the first thing I'm always asking them is like, what's your diet like? Because we're consuming food and we're not really paying attention to the sodium content of the food. So I'm all about telling patients, like, read the labels, especially if you're eating a lot of either like frozen meals, canned foods, things like that. They're high in sodium because they have to use the salt to preserve so that it has a higher shelf life to preserve these things on the shelves. So I'm always telling patients, hey, make sure you're paying attention to your labels, because that's could be contributing to the high blood pressure if you're getting too much sodium from those foods, and also fast foods as well. You don't really know how much sodium that's going into those foods, so you just want to be careful with what you're eating.
Thanks, Geraldine. Kimberly, I know that you are currently living a plant-based lifestyle. Is there anything that you would like to share with our audience today?
Oh yeah. So, so now we're really talking about risk factors, right? And there's two categories of risk factors. The first one is the kind you can't do anything about. That's if your mom or dad have high blood pressure, if you're Black or Hispanic, if you're of a certain age, which 40 is the number in healthcare that we look at because the data shows that that's when your risk really goes up. And what are some other? So yeah, so those are the ones, the most common ones that we see that you can't do anything about. Oh, and being male, men have a higher risk. So if you are a Black 40-year-old male and one of your parents is on high blood pressure medication, you are at the top of that high risk category.
Mm-hmm.
The other category is the things we can do something about. That's our weight, whether we move a lot, whether we move more than we sit down, and what we eat, whether we smoke or not. So when we look at what we're eating, which I would say eating and smoking are probably the two biggest reasons we see patients,
Mm-hmm.
right? And those are two things are in complete control about. Now, I recently talked about social determinants of health and the neighborhood that you grew up in, the zip code that you are born in. You have no control over that. And data shows that certain zip codes are at higher risk for certain things, including high blood pressure. Because if you live in a Black and brown community where it's easier to find a convenience store with chips and candy and soda than it is to find a farmer's market or fresh produce at an affordable price, then that's going to be really hard for you to follow any of these recommendations that
Yeah.
we're bringing up. So here on the screen, we have the DASH diet. This has been extensively studied in the literature, and it shows that when people follow these recommendations, they significantly lower their risk for high blood pressure and avoid getting on medication. And if they're on medication, it shows that it still lowers their risk for getting on a second one and increases their chances of being able to get off of it with the support of their healthcare provider. Another thing that's been extensively studied in the literature are plant-based diets. So plant-based diets largely don't consume red meat or pork, and that's where we see a lot of saturated fat. So if you don't consume those, if you don't bring them into your body, you're not going to have them. And those are the two things that help build up all that plaque that we talked about on the inside of that artery and all that gunk. Now, one time did I say you can't eat them? Like like it says at the top, it says you want to limit those.
Mm-hmm.
So, we talk about modifying when you eat something, whether it's like once a week or for Thanksgiving or Christmas, those would be really modifying it, and you really have to sit down with someone who's well trained to kind of decide what does modification look like for you. Because if you meet all those high risk categories that I mentioned, age, race, and gender, maybe you can't have it every week. Maybe you can't have it every Friday, because your risk is just too high.
Mm-hmm.
And yes, it might be more expensive to buy that smoothie or that salad than it is to buy that ham sandwich, but that's your upfront cost. You're still going to have costs on the back end if you end up getting things like high blood pressure, heart
Absolutely.
attack, stroke, because of healthcare is expensive. And so one thing so I'm in the plant-based community, and there's a lot of literature to support that lifestyle. And some people who follow a plant-based diet do still consume meat products or dairy products. It's a much bigger conversation for another day. But there is a group of people who promote what's called SOS, and they eliminate salt, oil, and sugar because those things increase your risk for high blood pressure, heart disease, and diabetes. And those are the main things we see people for in the hospital that lead to other complications and that are one of the main causes of why people are disabled and dying.
Mm-hmm.
Anything else I should add about that? Oh, I do want to say about sodium for salt, right? So when you look at the literature, it's going to tell you 2 grams per day. That's most people are not going to be measuring. I don't measure. I don't
Right.
take the calculator out and measure it. But what I did do a few years back when I first started following, I've been plant-based since 2017. But I started really monitoring my blood pressure pretty seriously when I got out of nurse practitioner school. I'm a high risk person because of my family history, my age, my race, my gender. And I took it 3 times a day for like 2 weeks, and I got a really good picture of how my blood pressure fluctuates, because blood pressure does fluctuate. It's not static. So when the first time you take it at 9 in the morning, it might be 121/79. You take it at 2 p.m. and it might be 122/78. So I was able to see how it fluctuated based on time of day, whether I was working out, what kind of foods I ate. And so what I found is that if I stay under 200 milligrams, like when you read the label, that it didn't affect my blood pressure too bad. And so the only way to know how much you're consuming is to read the label. And the only way to know what your blood pressure is and how foods affect you is to actually measure your blood pressure, because it's a silent disease, because you will not always have symptoms when your blood pressure is elevated. Salt attracts water. So the more you ingest it, it attracts that water, and that puts on, going back to that hose. So now we're not talking about the gunk around the outside. We're talking about the fluid that you're asking your blood vessels in your heart to pump. And so there you can also get more pressure from that. And so that's why the most common medication prescribed when you first get diagnosed with high blood pressure is that water pill, because we're trying to help the kidneys flush out all the excess fluid, which is why you might end up with the swelling or the edema. And some people get really used to that. They don't even know that. They think what they see is fat, and really it's water, it's fluid in their. I can look at someone in their hands, you can see those juicy blood vessels, those fat chubby toes and feet, and you can tell that person's consuming a lot of salt.
Thank you, Madison. It's when you were talking, it actually brought up another point that I was thinking about when you brought up like social determinants of health and things in the Black and Brown community that are specific when it comes to high blood pressure. And something that we see quite often in the hospital setting is what happens when our community takes blood pressure medicine and they start to experience side effects. So as we know, in there's evidence that shows that certain blood pressure medications can affect Black and Brown communities in a different way. So it's very important, as Kimberly was stating, that you take your blood pressure at home and take it different times of the day, and take it consistently, and really give that information to your primary care provider and let them know what you're experiencing. Communication is a two-way street. They tell you what they tell you, their recommendation, but you have to give them the truth about what's going on with you too. Are you taking it consistently? Are you taking it as prescribed? What's happening when you take it? Because we know there are certain side effects that come with these medications, and we could and different medications do different things. So if they need to prescribe you something different, or maybe prescribe you medications in conjunction, there's evidence and research out there that support that. But of course, they're going to try certain things first. But we have to know what's the medication's doing to you, so that we can make the best recommendations for you. So don't feel like it's just happening to you and it's happening. You're alone in this. Any provider really wants to help you have a healthier lifestyle, but also not give you anything extra have to worry about.
Yeah, every time you don't take your medication, I think we put a lot of emphasis on the heart and the brain, and I think people really don't appreciate the kidney until they actually have problems. And the kidney is essential. It is huge. It plays a role in everything. And one thing, every time you don't take your medication, you're causing that kidney to work really, really hard, and it takes a beating really well, and then it doesn't. After, and that doesn't come, it doesn't return. That's the thing. It's not reversible. And so every time you choose not to take it, every time you cut that pill in half, every time you skip it or forget it, you're hurting your kidney. And I'm sure we all want to avoid going on dialysis.
Absolutely.
So I want to point out real quick this particular blood pressure monitor. So the first one, this is by Omron, and I'll link everything in the description box. The first one I ever brought, I think it was by them. It was like a $40 one, and it has an app, which I said is super helpful. I'm not keeping track of paper. And my doctors, if I bring out a piece of paper, she's ignoring it, okay? But the app, she can thumb it, she can see yellow, green, red, easy, quick. It's like, okay, great, you're doing what I told you to do. But this one cost me about $80. It's an investment. I'd rather spend $80 on this than a trip to the emergency room or have to be on medications. And I can't tell you how many of these I've bought for people. I think this is the best gift you can give someone, in addition to telling them how to properly use it and when to seek medical attention.
Awesome. So I was just going to say, right before we recap, either Kimberly or Geraldine, did you want to share, what happens when we get either above that orange level or below that orange level? How you would, what you would recommend for your patients?
Great question. So yeah, this is something that I kind of experience a lot in my setting. I do want to point out this is a great chart from the American Heart Association. In the clinic, I oftentimes get patients that come in, I'll check their blood pressure, and then it'll be 120 over 80 or like 120 over 82. And they're like, oh, that isn't that like good? Shouldn't you be 120 over 80? And I have to point out to them that guidelines recently changed where that 120 over 80 is actually considered an elevated reading. It's not technically high blood pressure, but it is elevated. And where you want to be is less than 120 for your systolic blood pressure, which is that top number, and less than 80 for your diastolic pressure, which is that bottom number. A lot of times if I have patients coming in with like elevated blood pressure, meaning they're in like the 120 to 129 over that 80 range, we're just telling them we're not running to put them on blood pressure medications, but we are telling them hey, you have to be mindful of these numbers. I oftentimes ask them about what their diet is like, and what if they're and have a lot of caffeine intake, if they smoke, and my goal, or what I always tell them, is to cut back on certain things. I oftentimes tell them, hey, you don't have to cut everything out like cold turkey, because it's oftentimes hard to do. But I tell them to cut back, and then let's recheck that blood pressure. Let's see if it comes down by making those slight changes with lifestyle modifications. Now, when they're getting into the orange range, in addition to the lifestyle modifications, that's where we might start someone on a lower dose high blood pressure medication. We typically start small, see how you do. And if it helps control the blood pressure, great. And we tell you to continue taking it in addition to doing lifestyle modifications. And sometimes just losing weight a lot of times significantly drops the blood pressure. So that's always like my go-to, like exercise, diet and exercise can kind of help you not even be on medication. I've had patients that started on blood pressure medications in addition to taking their blood pressure medications and doing those lifestyle modifications. They were able to come off that medication completely. And that's always the goal. Now, when you get into that darker orange area, which is the stage 2 high blood pressure, 140 or higher, you definitely are going to be on blood pressure medications, possibly on higher doses. And when you get into that red range, which is super dangerous, that's when you're higher than 180 for your systolic blood pressure and higher than 120 for your diastolic, that is considered a hypertensive crisis, where if you come to me with that number, I'm sending you to the emergency room. Like that's where you need to go.
We're keeping you overnight, folks. You're not going home. Don't be surprised.
Right. Because patients don't realize how dangerous it is. And as Kimberly had mentioned earlier, like a lot of times you don't have symptoms. And I've had patients come in and say, hey, I feel great. But I'm like, you can leave here and have a stroke, or you can have a heart attack. Yes, you feel great, but this is what's happening in your body right now. And it's extremely important that you go to the emergency room so that they can get this under control. And then afterwards, we oftentimes tell them that you need to follow back up with your primary care doctor to monitor these numbers and make sure that you're not going back into that hypertensive crisis range.
Yeah, and so we are trained to always start with the least invasive, and that is lifestyle, right? Go work out, go exercise, and like I said, blood pressure is not like pain. It's not going to go away in 24 hours or 2 days. So we say come back in 3 months, because that is a realistic time frame for that change to take place. And it's not going to jump from 160 all the way to 120 in 3 months. It took longer to get there. It's going to take as long to get down, especially depending on how drastic of changes you make. Okay. Come back in 3 months, and you're going to hear that routinely, 3 months, because that's how long it takes for the body to make an adjustment. And in 3 months, it only might go down to the 150s. You're showing that you're doing something. It's moving in the right direction. We're still going to keep you off the medication. Keep making those changes. Next time you come back, it's in the 130s now. Great. We're still moving in the right direction. We'll keep you off those medications. But if when you come back, you went back up to the 160s, okay, this isn't working. We've already given you 6 months. We have to start talking about these medications because of the risk that it has to the rest of your organs.
Thank you both very much. Now, I know we have given you a lot to think about today, audience, But what we hope that you take away from this episode is being able to describe what happens to your body when you have high blood pressure. We hope that you're able to name at least 3 risk factors for high blood pressure and the complications associated with those risks. We hope that you're able to tell us or tell a friend the goal for your high blood pressure according to the American Heart Association, which, if you remember, is less than 120 and less than 80. We hope that you're able to properly measure your blood pressure at home and identify when to seek medical care. And of course, we hope that you remember to like, share, and subscribe to the Melanin Initiative. So remember, we release a new weekly episode, the TMI Tuesdays at 10 on YouTube and all of your favorite podcast apps. Be sure to check the description box for our social media links and a list of our resources related to the conversation today. Follow, like, and share our content with all of your friends. Thank you for watching.
Bye.
Thank you. Real quick, I just want to mention we talked all episode about the 120/80. That might not apply if you're diabetic or of a certain age. So make sure remember, this is for educational purposes only, and you do need to check with your healthcare provider on what is right for you. Thanks, everyone.
See you soon.